without art, science isn't complete. And I would say, which I think is highly misunderstood, art without science cannot exist.
Hi, I'm Manisha Vedpathak and welcome to my channel where we talk about art and space relationship and how art impacts its surroundings. We are into our first segment where we talk about art in healthcare, where we discuss how hospitals are now changing their perspective towards healing environment. Through this channel, we are talking to various healthcare professionals and get their views on the artworks displayed in the hospitals and their impact on the surrounding. Today we have with us Dr. Anupam Potdar. He is a dentist by trade and fueled by the passion for health promotion, health communication and digital marketing. Apart from his practice, he is a head of branding and promotion in the dental department of Symbiosis Center for Healthcare. And the most interesting part is he has a creative side where he is a musician, a singer, a writer and a foodie at heart. It's impressive, isn't it? So let's welcome Dr. Anupam Potdar. A warm welcome, Dr. Anupam.
Thank you so much. It's my pleasure.
It's a delight to have you here. Thank you so much for giving us this time. And I must say, what a multitasker you are. Yeah, because you do so much in so much with very wide interest you have in various fields, and I can't imagine how much time and how much work you have put into this, right?
I try.
Okay, to start with, let me put forth this question: do you connect with art, and how do you connect with art?
Absolutely. I think the main thing is art is everywhere. Wherever you look, you can either find art in what you see, or you connect with art that you actually see somewhere, like actual paintings, anything. So connection to art, I think, starts from the childhood. We can connect with so many things from learning painting, but I think most common at this age, I think, whenever you go somewhere where you see a painting, you look at it, you try to understand it, at least from your perspective.
Right.
And maybe it makes a little bit of difference to your life sometimes. It changes your mood, maybe it makes you feel better. So on a variety of levels, art is something that I think connects deep inside us somewhere. So art is everywhere and you connect to art all the time.
Okay. So you are a qualified doctor and you run this clinic with a good footfall and you have a painting in your clinic.
Correct.
It would be interesting for me actually to know your thoughts about incorporating art into your clinic as well as maybe into your house also. What are your thoughts on that?
Correct. So I think art can have many facets in a healthcare scenario, because right from the color of your walls or your instruments, your setup, that can make a difference. And obviously paintings, where you place them and what kind of paintings you place can have a huge effect on the psyche of the patient. Now I am a dentist. So the first thing I hear most of the people say when I meet them is, I hate dentists. So because they're scared of dentists. So to change that perception, somebody who's scared of the dentist will feel comfortable when they're comfortable with me and when they're comfortable with the environment.
Right.
So when they have something that will make them feel more comfortable, that will make them less anxious, that makes our job easier, because a comfortable, less anxious patient is a pleasure to work on.
Right.
And an anxious patient can be difficult. I'll put it mildly. So, in a healthcare setting, especially for a mildly surgical branch or a branch where we are directly working on a patient physically, there the patient's comfort and the environment affecting the patient's you know stability or their comfort is very important. So I think art has a very big role in that.
So during your dental practice, do you use art therapy?
Art therapy, actually, I haven't used art therapy directly, per se, or maybe we have used it without understanding. So I'll give you an example. So if you look at my clinic, this wall is painted purple.
Oh yes.
So there is white and there's purple. The reasoning behind that is white gives you a very clinical, very precise, stable feeling. That a clean white surface says ki okay, this clinic is clean. This is it's definitely not dirty or unsanitary. But when the patient is staring at this wall most of the time during the treatment, so having a cool color like blue or purple or something like that on a subconscious level will relax the patient, will make the patient feel comfortable. A bright color or a very offending color might add to the patient's anxiety. So there isn't a painting here, but like you can see this painting here of a calm sea with a boat. So that sort of relaxes the patient, gives the patient a sense of serenity. So cool colors, scenes of serenity, something that can calm the mind. That helps a lot. And with children, what we do is we hang some sort of a soft toy on our light or something like that. So when we are working on the patient has something to look at,
some visual object.
Yes. So thinking back, I think that maybe we haven't used art therapy directly, but indirectly we end up doing a lot of these things to make the patient comfortable, or have the patient look at something else as a distraction without them understanding it.
Do you think that your dad was a painter and his paintings have helped you in this process?
A huge influence. I mean, our family, you could say in a staggered manner, has always been into arts, music, painting, all these things. So dad was the only painter I knew basically for the first half of my life, you could say. So having that vision, having that visual or artistic outlook towards things, to understand colors, just to look at things in a different manner, he has a huge role. I mean, there are some things that you don't even realize, how many influences people have on you. Absolutely. So dad had a huge influence. Unfortunately for him, I neither became a painter nor a cricketer, nor a sports person, which he was into. I ended up becoming, a very artistic sort of person.
But somewhere into your journey, that must have helped. But you are not aware of that, but that must have helped.
No, I know how much that has influenced, because it translates to a lot of things. Painting, it's not like that painting will not influence if I'm doing music. It helps in my music. Music helps in painting.
Yes.
And having an analytical mind with an artistic side helps a lot, because people who are trying to solve maths or science or physics as numbers or diagrams becomes difficult. If you can slice physics into colors, into your everyday experiences. If you're learning about gravity, if you just learn about gravity in numbers, that G is equal to 9.8 or whatever it is, I think I've forgotten. But if you try to learn it, okay, I'm feeling gravity. So what effect does it have on me? I have to push to lift my arm up. I cannot keep my arm. So these physical experiences of learning all these things through an artistic perspective, if you divide a circle into multiple sectors, if you think of those sectors as different colors, it will help you understand it much better. If you just do this, okay, this is 90 degrees, this is it has a lot of transition. So that also, not just healthcare, education in our schools also, using art there also makes a huge difference. So as a kid, having an artistic as well as a scientific background
Hmm.
develops you as a student, as a human being a lot. Without art, science isn't complete. And I would say, which I think is highly misunderstood, art without science
Yes.
cannot exist, because
True.
art is science, science is art. It's just looking at it from a different perspective.
That's cool. That's
So
cool.
I think having a painter as a father who was into music as well makes a huge difference. Your perspective of the world is different.
Yes. Okay, if you're looking at a painting, what do you normally think of? Do you read the painting? Do you appreciate it? I mean, what do you think about it?
It depends on a lot of things. But I think the first thing that we, intrinsically connect with the painting is, I think what it makes you feel, and if it triggers any memories. Because
Right. That is how
You
you
know-
connect with the painting.
that is the first thing I think
Yeah.
I do. Because, sometimes you don't realize that a painter has painted something where you have visited, donkey years ago. Like
Yeah.
you might have visited when you were 6, 7. You don't even have any actual memory of the place.
Yeah.
But you can look at that painting and just, see, it's a feeling of deja vu, and then it strikes
Right.
you, "Arey, no, I think this is
Yes.
that place," and then you remember.
Yes.
So that is the first thing, I think,
Okay.
triggering memories, triggering some sort of, it can trigger something else. So the next thing that I notice sometimes is, if it can remind you of some people. Like some paintings, it might be the colors, it might be what the painting is showing. It can remind you of people. So that is a very, a wonderful thing. And then somebody like me who loves to overanalyze everything. For me, then looking at a painting, all hell breaks loose, I think, because I can think, this is happening, that is happening, this painting just has a few colors with a few strikes here and there, but then you start thinking, does that, painter mean this? Does the red mean fire? Does the orange mean something is burning? Does the blue mean
That's
there's
about
a river?
reading the painting.
Exactly. So then, depending on how much time you have, you can
Yes.
let your mind run free, and you can just maybe think of something that a painter hasn't thought of, probably. So an overanalyzer like me probably is reading too much into a painting. But I think that's the fun of it. I mean, instead of looking at your phone, if you are connecting with art,
Huh.
that's
That's
and again, art connects somewhere deep inside you without knowing. Somebody who doesn't understand art or know art can connect with a few paintings because it reminds them of something.
It's
So,
true. It's very true.
Powerful. It's beautiful.
So you think that people should appreciate the
100%.
paintings, and also hospitals should incorporate
They
artworks.
should. They should.
You agree to that?
Definitely.
Right. So when you see these artworks in the hospitals, what type of artworks are these? What type of or what style of artworks?
Usually it is, I see landscapes or portraits. I think the maximum I see most of the time is paintings or some print of the owner or the fathers of the owner or the family.
Okay.
So that is, I think, what I see the most. But apart from that, if actual art is there, then usually it is landscapes or some sort of very generic thing that you can find anywhere. So archis, there can be Buddha, there can be some religious
The sculptures.
sculptures, no, or even
Even the
paintings,
paintings.
or landscapes maximum.
Landscape,
Beyond that,
maximum like nature themed
nature theme,
paintings.
yeah, something like
Okay.
that. Not unless it's a pediatric hospital. I've seen a few pediatric hospitals with cartoons or
Yeah.
clowns or something colorful to pop up the
related to
place.
kids,
Yeah,
yeah.
related to kids. I think that's the maximum I've seen.
Okay. So according to you, the art must be incorporated into hospitals.
Absolutely, and not just
And
waiting
that-
areas. Yeah,
That does have impact on the patients.
that very.
Not only
and
patients actually, patients' relatives.
patients, relatives,
Also.
and I'll tell you the doctors and staff as well.
Yes,
because-
staff also, because staff
Absolutely.
are also very overworked or
Exactly.
very busy people in the
Very
hospitals.
true. I think COVID
And-
was the first time when people actually talked about stress in the healthcare industry within the staff. But then obviously it has gone away. We thali bajaya humne ek baar. That is the
Okay,
most
yeah.
we did, I think, for the healthcare industry. But the patients are anxious, or for obvious reasons. The
Yes.
relatives are stressed for very obvious reasons. So the doctor is going to reduce their stress by treating the patient.
Right.
But when the patient is just sitting around, or when they are in the procedure room, the operating room, or in a dentist chair, if where they are sitting opposite to that, if there is a painting, if there is some sort of art where they can distract themselves,
Yeah.
it makes the patient so much more comfortable. It makes the patient so much more stable. Like I said, the doctor has a easier job, the nurse has an easier job. If you don't have to hold down the patient,
Yeah.
the procedure is better, the outcome is better, everything is better. And relatives, when they are waiting outside, a serious patient is being operated inside, it's all anxiety, it's all jumbled
too
up.
much stressful
Exactly.
situation there.
And they are not wrong. Somebody they love might not be
Yeah.
there.
Yeah.
A few minutes later, it's a horrible sensation. So, creating an environment which, will at least externally make them feel a little more comfortable, and in a very noisy, stark white or a very drab environment, your anxiety levels go up.
Yeah.
If the colors, the design of the place and paintings, if they have a calming effect on you, even if it is 5%, 10%, that makes a huge difference. A relative reacting to a bad scenario, just being disappointed or becoming aggressive, that 5-10% can have that difference as well.
Yeah.
A patient who's just anxious but calm, or
Yeah.
the relative, makes a huge difference. The doctor being calm and relaxed while going to the patient,
Exactly.
the nurse who's doing all the preparation, if they are calm, the efficiency of work goes up if you are calm.
Yeah.
So artwork, even though it might be from outside, it might not be a direct effect, but that indirect effect has huge connotations. It is going to improve healthcare. It is going to improve the patient-doctor relationship. It is going
Exactly.
to, and our bodies are balls of miracles. That is what we have realized. Your mental state has a huge effect on the outcome of your procedure. Your healing is faster if you are mentally calm.
Yeah.
So all these
the
things,
tolerance to the pain is also reduced.
absolutely, exactly.
Yeah.
So a calm patient, environment which is more relaxing, is going to heal the patient faster. The body is going to heal much faster if the patient can be relaxed. So I mean, for a place like India where we are fighting for roti kapda makan,
Yeah.
I think this become secondary. You couldn't call it a first world problem.
Yeah, but now since
now-
people are getting to know, I mean the people in the administration of hospitals, they need to know
Exactly.
that these artworks are helpful for the patients, and then only I think the artworks or whatever it is, I mean sculpture or installation, that will start coming into the hospitals.
Definitely. And it will trickle down. Like if it starts in very small places, or very high-end hospitals, but if
Yeah.
that slowly trickles down to even the basic primary health care, even in rural places, if if it trickles down, it can transform the healthcare industry, at least
True.
in some way.
Yeah. Thank you so much, doctor, for your time, and we have such an insightful talk with you.
It was my absolute pleasure and honor to be part of this, and
Yeah.
working in branding and promotion in Symbiosis. So this is something that I'm working on there as well.
Okay.
Improving the perception of people.
Yeah.
So I think it gives you a great opportunity to explore art from your side as well, and bring in whatever little I have from my side as well.
That's so great.
I think it's
That's
a
great.
wonderful time to talk to you, and
Thank you
hopefully
so much.
incorporate this in our healthcare industry.
Yes, thank you so much.
Thank you.
So guys, this was Dr. Anupam, and we will see you in the next video with yet another doctor. Till then, namaste, bye bye, stay healthy and take care.